nearly 1,500 people have died in our community of this deadly disease. It is my understanding that that's 19 more deaths than we reported to you at the beginning of this week. The 14-day positivity rate has slightly declined. It's a bit of good news that we're at 19.27%. The number of residents ages 12 and up who have at least one shot or more of the vaccine is now at 66.51%. So we are moving up. Camping World Stadium remains the largest single-site vaccination location in Orange County. It offers the Pfizer or the Moderna vaccine. Over the past 2 weeks, nearly 2,300 shots have been given to individuals at that location. Our testing sites continue to administer well over 4,000 COVID tests a day. Yesterday, 4,427 tests were administered by our staff. Both the vaccine and testing sites are open 7 days a week between the hours of 9 a.m. and 5 p.m. As a reminder, the locations of the 3 free Orange County Health Services run testing sites are Barnett Park on the west side of Orange County, the Econ Soccer Complex on the east side of the county, and the former Claricona Elementary School in the Apopka area. We ask that you go to ocfl.net/testing if you need more information. We are working to increase the visibility of our mobile I Got My Shot trailer. It continues to be a success in our community. You can get a vaccine today until 6 p.m. at the Orange County Tax Collector's Office in the Lee Vista area out off of 417 in the east side of Orange County. Tomorrow you can grab a snack and a vaccine at the mobile trailer, which will be at the Buffalo Wild Wings in the area of UCF on University Boulevard between the hours of 4 p.m. and 8 p.m. Then on Saturday morning, our partners at the Department of Health will be giving shots at the Inglewood Neighborhood Center on La Costa Drive in the Cimarron corridor. As of yesterday, more than $7.3 million have been approved through the county's Emergency Rental Assistance Program. This means that 1,310 families can continue to stay in their homes. Emergency rental assistance to our programs have been hosting in-person office hours at select Orange County Library branches. The goal is to help residents applying for the program. The program will host its last scheduled education assistance event tomorrow between the hours of 10 a.m. and 1 p.m. at the Chickasaw branch located at 870 North Chickasaw Trail on the east side of the county. Residents can learn more about this service as well as program information and eligibility by visiting ocfl.net/rental assistance. And finally, I want to talk about the vaccine requirement for our Orange County employees. I'm pleased to report that as of yesterday, 66% of our county non-union employees are fully vaccinated. Overall, 55% of all county employees are fully vaccinated. We believe the number is higher. We still have some employees who have not yet completed. However, there does appear to be a bit of confusion among our employees about the deadline to get at least one shot. I believe the deadline confusion has risen because of our talks with union employees. The talks were not to negotiate a new deadline, but to work with unions to make sure that their members fully understood the mandate. And with the exception of the firefighters union, I'm happy to report that we have reached agreement on how the mandatory vaccine order will be executed. In order to allow for more discussions to occur and clear up any confusion and avoid unnecessary conflict, a 1-month extension will be offered to our employees. Employees must have their first dose by September the 30th and have completed the series by October 31st. And now for the employees who have already stepped up to the table and up to the plate, who have already gotten their shots and who have adhered to the rules. I say thank you to them, and we will be proposing an incentive for those employees before the Board of County Commission at our meeting on September the 14th. The plan is for non-union employees who are fully vaccinated or who have their first dose by August 31st to receive a $250 bonus and 1 day of personal leave. If you meet the vaccine requirement after August 31st, but prior to September 30th, but a non-union and union, both non-union and union employees will get a day off. That way there is no confusion. My goal truly here is to ensure a safe work environment for all Orange County employees and protect our residents during this health crisis. For the last several weeks, we have reported that we have new employees who are testing positive and employees who unfortunately have died of the virus. As a reminder to everyone, the Pfizer vaccine received full FDA approval on this past Monday. So we hope that those who may have been sitting on the fence are encouraged by the fact that it is fully approved at this point, and that will encourage you to also go get vaccinated. So I also appreciate our citizens who have stepped up to get vaccinated, and we encourage more to do the same. I also applaud our businesses and companies who are also mandating their employees get COVID-19 shots or creating various incentive programs. All of that helps us to move the needle to get to that 79 or 80% threshold of as we endeavor to reach herd immunity in our community. And so now I'm going to turn it over to Dr. Pino to share additional details. Dr. Pino.
Good afternoon, Mayor. Thank you. Thank you, everyone. Before I give the numbers, let me say that you are going to receive mixed messages because on one hand, I'm going to talk about some lighting, at the end of the tunnel with the data that continues to, some data points continue to start looking that they are recovering, and there are some data points that are worsening. And we knew that we would be here at this point, and we have been here before, where we have an increase of the number of deaths, and then we have some kind of stabilization on the pandemic itself. But I want to explain to the public that also the pandemic is moving to the younger segment of the population, which is highly unvaccinated. They don't qualify for the vaccine yet, but they are representing about 20% of the cases in any day. People who are between 5 to 14 years old are representing about 20% of cases. Yesterday was also an abnormally low day for the number of cases. I have to consult with my team. It was less than 1,000. And I know that sounds like, oh, really? Yeah, there are days we have been at 1,500 cases a day. The total number of infections in our county is up to 201,835, and the 14-day rolling average is at 19.2. That's a little bit of a decline. The highest we have been, it was at 20.5 on the 19th of August. So there has been some movement in that area. But as I mentioned to you, the number of deaths is at almost 1,500, so 1,499. And the age of the group that we are going to report today is 28 to 96, with a median age of 72. And those are 19 additional deaths. They are all from the month of August. 10 female, 9 male, 3 black, 1 Asian, 11 white, 4 of other race, 9 were Hispanic, 10 were non-Hispanic. 14 had underlying conditions, 5 we don't know at this point. And as I mentioned to you, all the 19 deaths are from August. Now, 3 of the deaths are from assisted living facilities, and you, the press, asked for this data. 5 of the 19 were fully vaccinated, and those were over 70 years of age, and all of them had underlying conditions. I remember that you have asked for this information. We may not be able to offer every time, but at least we have the ability to do it right now. And the median age between completion and a positive lab, meaning completion of the vaccination series, I believe you asked for that question too, was about 5 months. We also continue around the county to offer the third dose for people who are immunocompromised. Please talk to your provider before you decide to take the vaccine. That is advisable for you due to your conditions. And remember that Publix, Walmart, Winn-Dixie, Walgreens, and CVS are also offering vaccinations. Also remember that at the World Camping Stadium, there is a monoclonal antibody therapy for post-exposure treatment of COVID-19. Our rate per 100,000 has also declined a little bit. The highest was 627 on the 31st, and the 31st week, we are on the 33rd week, and right now is at 575. As a curiosity for you, some people who follow the data, I'm going to give you the numbers immunization, but first I want to mention to you that this month we are at 73 number of deaths. The prior month was 58, and that was July, and then June was 31. So we are right on time, seeing an increase in the number of deaths due to the increase of number of cases that we have in recent weeks. Yesterday, I was 25th. There were 3,239 vaccines reported to the state. 393 were boosters. 1,377 were second dosed, and 1,519 were first dose. With that, I will answer any questions that you may have. Thank you.
Okay, thank you, Dr. Pino. Just today, we also are joined by several of our commissioners. I see Commissioner Gomez-Cordero, Commissioner Uribe, Commissioner Wilson, and we also have the County Administrator, Byron Brooks, who joined us today. We have Mr. Scott Howard from Orange County Public Schools, who is also here. So if we need to translate any questions or commentary in Spanish, my special assistant has joined us today and can do that, and of course Dr. Pino is fluent as well. So with that, we'll open it up for any questions.
Steve Hudak from the Orlando Sentinel. I want to talk a little bit about deaths. Can you help us understand what it means when we have vaccinated people who are dying of COVID?
And that's always a very interesting question. And now that that at any age, the death change, the impact that has on the family. But when you have pre-existing conditions and you are of advanced age, we know from the history of the pandemic that the outcomes tend to be a little bit different. The reality is the vaccines are not and will never be 100% effective. There is no vaccine out there that is 100% effective. And the fact that individuals are of age and pre-existing condition do place it at a higher risk. Also, by the number of months between the doses was completed, so all those individuals are also getting closer to the 8-month mark that the CDC and the government have noticed that is a decline in the immunity process. So that's why we are advising the third dose for those who are immune compromised, and in the near future for the population at large that may have been vaccinated at the beginning of the campaign. So I think that all of that could play a role, but sadly, this does happen. But when you analyze the data at a larger scheme of things, about over 95% of the people who have died since we completed the first series has been unvaccinated, and about a little over 95% also of the people since we completed the series that are hospitalized are unvaccinated as well. So vaccines continue to be effective.
Lauren Seabrook, Channel 9. This question's for both of you. We obtained an email this morning saying that Advent Health's morgues are at capacity and that they have some additional refrigeration that are also almost full, that they're reaching out for help on this, and that because we're not under a state of emergency statewide, they're not able to reach some assets that they maybe would be otherwise. Are you all doing anything on a local level to help Advent Health or any other hospitals that are dealing with this?
In my case, those assets do not rest with the Department of Health. I believe they are with the Department of Emergency Management, if I know that correctly. A request will never come to us. In those cases, it will go directly through emergency management. But I know the same news that you know, in the sense that just right before we came into the press conference, Steve brought it to our attention that this is happening, and I'm not surprised that it could happen. It had happened in the past.
The only thing I would add, through our emergency management division, we were notified that even those facilities that offer cremations, that some of them are at capacity, and yes, we were made aware that some of our hospitals are at capacity. So in terms of the Orange County Medical Examiner's Office, I know that not just through the COVID-19 deaths, but deaths may be up in general across the county. And so we are working to try to understand how we may be able to offer some relief in that regard. It is undefined at this time. There are detailed plans within the state of Florida for these types of situations that may occur, and it may require a request to the state for additional refrigeration portable units to be deployed, but we're just doing an assessment at this point to determine how critical that is, and so we don't have the final answer today, but we're working through it.
Troy Campbell with Channel 6. This question is for you, Mayor. On Thursday, today, during a press conference, the governor said that there will be an announcement made soon by the Board of Education. And there's been talk about taking pay away from district leaders that aren't following the governor's order. President Biden has said he would encourage local governments to use ARP funds to facilitate that void. Is that something you've considered or would be willing to do if that pay is docked?
I'm not aware of any situation where the governor can dock pay or what have you related to any of the mandates that we have in place from Orange County government or that I have issued at this point. Of course, in regards to the school districts, that's something that is evolving, I believe, as we speak. Doesn't sound like the right thing to do, because ultimately, if you take money from the school districts, you're taking money from the children and the students in the district. That's the way it works. And so there's litigation throughout the state, and I think in the coming days or weeks, the courts will help define who has authority to do what. So what I say to our public is, at this point, don't fret over that so much. Let's all do our jobs to protect our residents, to protect our children, our students, and the rest of it will work itself out. I believe that those school districts or other local governments that have taken action, they're well aware of the governor's orders and the threat of punitive action, what I believe is punitive action. Those are my words. But sometimes this is where the courts have to interpret what the law really means and who has the authority to do what. So I believe that will work itself out in short order.
Mayor, Greg Fox, West 2 News. Can you tell us, again, this incentive plan for employees to get vaccinated, especially in light of this recent death among your staff, but you want to expound a little bit more on why you think that's important?
Our goal in the very beginning was not to be punitive to our employees, but to protect our employees and to protect our citizens. And when we see positive response to the directives that we put in place, and especially in the environment that we have here within our community, we're seeing a number of organizations, public and private, who are creating incentives for their employees. And so we want to mirror the best practices that we see within our community. And so that's something that I'm going to suggest to our Board of County Commission that we do. I believe that as an employing entity, we're compassionate people. We're not here to do anything that is inappropriate. We want to treat our employees with dignity and respect, and I think that that is something that provides an indication that what we're trying to do is the focus is on saving lives. And when I have my employees dying on a weekly basis because of an exposure, when I have employees who are increasingly testing positive in order to protect the workplace and to protect our residents, because some of our employees don't get to choose whether they're going to respond to a call for service in this community. Those first responders, they don't get to choose whether they're going to do that. That is their jobs. And so in many ways, we're sending them into situations where we know that individuals are complaining that they are ill, they likely may have COVID, but yet they have to go anyway. When we run a jail where we house individuals who sometimes do not make healthy lifestyle choices, and they have to remain in our care and custody, when we send our employees into those environments and they must go, then we also have to protect even the inmates that we're responsible for while they're in our care and custody. And this week we've had, I think, somewhere north of 70 inmates who have also tested positive. I have other employees who are also hospitalized in critical care units. And in some cases, the prognosis for them is not good either. So I'm not here to be timid in my leadership role as the crisis manager during this emergency. I'm here to make decisions that save lives, and I believe that the actions that I have taken at this point is truly focused on that, and that is to save lives. Sometimes even when people make poor decisions and don't want to save their own lives. So I think back to my time and tenure as a law enforcement officer and responding to individuals, for example, who wanted to commit suicide, individuals who did not want to live. But we saved their life, and some of them afterwards thanked us for that. And so sometimes that's the role of government, is to keep the people safe even when they may not want to keep themselves safe. And that's where we are here in Orange County. Long way to answer your question, but hopefully I answered it. All right.
This is Kelsey Thord with West 2 News as well, and kind of continuing with Greg's question on the employee vaccinations. Are you worried that by extending the deadline another month, that kind of takes away a little bit of the push to get employees vaccinated, takes away a little bit of the seriousness of it? And then I know you said that just about 66% of employees have at least one shot as of now. Are you worried that that additional 34% aren't going to get vaccinated by the new deadline? And if so, I mean, are you really going to be able to, how would you punish that many employees? That's a big chunk.
Well, we have to make reasonable decisions. Am I worried about it? No. I see our employees step up to the plate every day and do what needs to be done. If there's any error in communications, then we want to clarify that. there was at the negotiation table this past Monday, our lead person who was sitting there having the conversation or the discussions with the International Association of Firefighters local union could not be there due to an emergency that happened. He could not be there. So I think that in terms of those conversations, they were not what I would have desired them to have been. So we're just simply adding time. And remember what I said, the goal was not to be punitive in the first place, but to get an increasing number of employees who are getting vaccinated. And sometimes we have to mandate things to have the kind of outcomes that we want to have. So this is a public health crisis that we're living through, and so we're going to be decisive during that process.
Eric Sandoval with News 6. This question is for Dr. Pino. You mentioned that young people between the ages of 5 and 14 are making up 20% of the new cases?
About 20% of the daily cases, yes.
How concerned are you that that number could grow more, and what message do you have to parents as they send their kids off to school in the morning?
So first, let's reflect a little bit on the fact that a lot of those kids are not eligible to be vaccinated. So there's no way that they can take the shot at this point. Later on, it would happen. So with that said, it is kind of expected that that's where the pandemic numbers are going to increase while we are vaccinating and protection through different measures. It is concerning, but I want to take the notion that it's not because they are in schools. That's not the issue, because that's where they probably need to be. But it's the fact that when you increase social activity, it could be a school, it could be a holiday, it could be a party, it could be, when we come together and we get close to each other, that's when transmission do happen. And it is happening in the schools. We are working very close with OCPS, extremely close. But also the reality is that this volume, we don't have the capacity to get and do quarantine and isolation. We are much better in isolation, but quarantines are more difficult. Why? And that's the concerning part, is because if an average individual that is positive generates 4 to 6 contacts, and we have average a day, I'm just calculating from the top of my head, 1,000 cases a day right now. That is 1,000 cases plus 6,000 contacts. How in the world can we call and get in touch and do everything that we have to do with 6,000 people a day? Because placing someone in quarantine is not saying, hey, you go to quarantine. We have to determine that the person needs to be in quarantine. And that takes a few minutes on the phone if the parents respond the phone at the time that we call, if we have the right number, and if we are able to communicate with them. So there is a lot of nuances in the fact that trace investigation and contact is not happening in a timely manner right now due to the number of cases that we are having.
This is Melissa Thomas of Florida National News. This question is for you, Dr. Pino. Does the Department of Health, like on the state level, do you know if there is any particular push from their end to speak to those at the federal level to get those vaccines made available for that younger population who can't get vaccinated yet?
No, I think that that's more FDA decision. I understand from reading that the news and other elements that that data was kind of delayed due to the number of people that you have to have in the clinical trials to be able to demonstrate efficacy, but also the side effects. Because now we know that the vaccines are very, in the 90s, and that's a good thing. But also for children, you have to consider other factors, development and other areas, so how the vaccine is going to, and what type of side effects you could see. And remember, when I talk about side effects, just for the public, remember that we are vaccinating 300 million people in a very short period of time. So that means statistically that you are going to see every single possible side effect in that short period of time because the large number of people that you are vaccinating.
This is Samantha Sosa with Fox 35. Mayor Demings, this question's for you. What is going on with the negotiations with the firefighters union? Recently, a state rep from out of the area said 200 firefighters will be fired because of your vaccine mandate. Any truth to that? And do you have any insight into vaccination rates among Orange County firefighters? Thank you.
I don't know who that state representative is, but he doesn't know what he's talking about. We have established disciplinary processes, and we haven't even gotten to the point yet. So he doesn't know what he's talking about, whoever that person is. Not sure what the question was just then.
If you have any insight into how many firefighters are vaccinated versus not?
Our HR has that information based on the test stations that have been presented. I just don't have it here today, so perhaps they can follow up with you afterwards.
Next question was texted in from Matthew Petty with WMFE for Mayor Demings. Mayor, do you have an update on OUC's oxygen supply? How close is Orlando to needing to issue a boil water notice? And is Orange County Utilities facing similar shortage of liquid oxygen at this time?
I don't know the status of OUC's inventory at this point. In terms of Orange County, no, we are not at that level. We have no current likelihood that the demand for liquid oxygen will be exceeded because of our usage levels here within Orange County.
Thank you. That's it.
Okay. If there are no other questions, thank you all for coming today. We hope that you have a safe weekend, and the next press briefing is scheduled for Monday, this coming Monday, and we are doing it Monday at 11 a.m., Monday, 11 a.m. All right, thank you all for being here.